There's a sentence I've heard more times than I can count, from patients of all ages, all backgrounds, all levels of education. 5 words that sound perfectly reasonable, and yet, from a clinical standpoint, may be one of the most misleading assumptions in healthcare. But doctor, it doesn't hurt. And I understand. Pain is our most intuitive alarm system. When something hurts, we pay attention. When it doesn't, we assume everything is fine. That logic works in many situations, but in the mouth, it can be dangerously misleading. Because some of the most consequential oral conditions, the ones that can lead to tooth loss, chronic inflammation, and long-term damage to the structures that support your teeth, can develop over months or even years without producing any noticeable pain. This is what I call the silent mouth, and understanding it may be one of the most important things you learn about your oral health. Let's start with the biology. Why can serious damage happen in the mouth without triggering pain? There are a few reasons. The first has to do with the nature of chronic versus acute processes. An acute infection, like a dental abscess, tends to produce intense localized pain. That's your body responding to a sudden threat. But chronic processes work differently. They unfold gradually, often over years, and the body's response is more subtle, a low-grade inflammation that doesn't activate the same alarm signals. Biology doesn't always signal early damage with pain. In many cases, it adapts, quietly. Periodontitis is one of the clearest examples. It's a chronic inflammatory condition that progressively destroys the bone and soft tissue that hold your teeth in place. And in most cases, it advances without causing significant pain in its early and intermediate stages. By the time a patient notices something, tooth mobility, a shift in alignment, or discomfort while chewing, the damage can already be substantial. A systematic review published in the Journal of Clinical Periodontology estimated that a significant proportion of adults may be affected by some form of periodontitis. In some populations, more than half. And a considerable number of them may be completely unaware of it. The second reason is structural. The supporting bone structures around your teeth are not highly sensitive in the way we might expect. That means they can lose volume progressively without the person feeling anything specific in that area. It's not like a fracture. It's a slow, quiet erosion. 3 stories you may recognize. To make this more concrete, let me describe 3 clinical scenarios that I encounter regularly. These are not extreme cases. They're everyday situations. The first, a patient in their early 50s, no pain, no complaints. Comes in for a routine check because a family member suggested it. Clinical and radiographical examination reveals generalized bone loss, deep periodontal pockets, and early tooth mobility. The patient had not visited a dentist in over 5 years. Their response? But nothing ever hurt. And in that moment, there's always a pause, because what the patient expected to be a routine check becomes something else entirely. The second, a younger patient, mid-30s, who notices a small dark spot on a back tooth. No pain at all. Radiographic examination reveals that the caries has already progressed through the enamel and deep into the dentin, approaching the pulp. The outer surface looked almost intact. What was visible was only the tip of the process. This is something we see often, and it challenges the idea that you can assess your own oral health just by looking in the mirror. The third, a patient who has been told for years that everything is fine. They brush, they floss occasionally, they don't have cavities. But a thorough periodontal evaluation reveals bleeding on probing, early attachment loss, and elevated inflammatory markers. This patient has active disease, just not one that's loud enough to be noticed without the right examination. What do these 3 scenarios have in common? In all 3 cases, the absence of pain created a false sense of security, and in all 3, earlier detection could have made a meaningful difference in the outcome. This is precisely what a systematic review and meta-analysis explored when it assessed the relationship between periodontitis and quality of life. The findings confirmed that periodontitis significantly worsens oral health-related quality of life, and that the impact may increase with disease severity. In other words, the longer these conditions go undetected, the greater their effect. Now, I want to be very clear about something. If you've ever waited until something hurt before seeing a dentist, that doesn't make you careless. It makes you human. We've been trained to react, not to monitor. But there's also a systemic dimension to this. In many healthcare models, dental care is still structured as a reactive service. You go when something breaks. Insurance coverage is often oriented toward treatment rather than prevention. And the idea of visiting a dentist when nothing is wrong can feel unnecessary, even wasteful. This creates a cycle. People delay visits because they feel fine. By the time they do seek care, the disease has progressed. Treatment becomes more complex, more invasive, and more costly. And the perception becomes going to the dentist means bad news. A systematic review of longitudinal studies on dental visiting patterns found that regular preventive attendance was consistently associated with better outcomes, including fewer missing teeth, less caries experience, and better overall oral health-related quality of life. The evidence suggests that frequency and consistency of care matter, not just going when symptoms appear. The real question is, what if we could break that cycle? What if we shifted the way we think about oral health from reacting to symptoms to actively monitoring what's happening before those symptoms ever appear? If pain isn't a reliable guide, then what is? The problem is not that the mouth is silent. The problem is that we don't know how to listen. The good news is that the mouth does communicate, just not always through pain. Bleeding when you brush or floss, that's not normal. It may seem minor, but it's often the earliest visible indicator of gingival inflammation. Persistent bad breath that doesn't resolve with hygiene alone. Subtle changes in how your teeth align. A tooth that seems to have shifted slightly. Sensitivity that comes and goes. Not constant, not sharp, but intermittent. These are all early patterns worth paying attention to, and learning to notice them is a form of health literacy. And then there's what you can't detect on your own, and this is where professional evaluation becomes essential. Periodontal probing can measure pocket depth and detect attachment loss that no mirror at home will reveal. Quality radiographic imaging, including bite wing and periapical views, can identify bone loss and interproximal caries that are invisible to the eye. And in selected cases, advanced imaging, such as cone beam computed tomography, can provide additional information about bone structures and spatial relationships that standard X-rays cannot capture. Research into early caries detection has highlighted that many lesions begin at a subclinical level, invisible to the naked eye, but detectable with advanced optical and imaging methods. The challenge, as one review from the University of Geneva noted, is that dental care has traditionally focused on detecting caries at the cavitation stage, when the damage is already done. Shifting toward detection at earlier stages could fundamentally change outcomes. So, if the mouth can be sick without hurting, and if the most important changes happen before you feel them, then the dental visit needs to be understood differently. Going to the dentist when nothing hurts isn't overcautious, it's strategic. It's the same logic behind checking blood pressure when you feel perfectly fine, or running baseline blood work once a year. You're not looking for trouble. You're establishing a reference point so that when something changes, you catch it early. And interestingly, this is something I see more and more in my clinical practice. Patients who come in not because something is wrong, but because they want to understand what's happening before it becomes a problem. No pain, no urgency, just awareness. The dental visit should be an act of intelligence, not of anxiety. It should be driven by curiosity, not by crisis. And it should be part of a broader strategy for long-term health, not a last resort when something has already gone wrong. This is the foundation of what dental longevity is about, a proactive approach to oral health, one that respects the complexity of the mouth, acknowledges the limits of pain as a diagnostic tool, and builds a framework for prevention that actually works. So, to close, if there's one idea I want you to take from this episode, it's this. Silence is not safety. The absence of pain is not a diagnosis. Your mouth can be actively losing bone, harboring chronic inflammation, or developing early-stage caries, all without you feeling a thing. That's not a design flaw. It's just how biology works. And the fact that these processes are silent doesn't mean they're harmless. It means they require a different kind of attention. Learn to notice the quiet changes, and don't wait for the loud ones. In the next episode, we're going to go deeper into one of those quiet indicators, what your gums are really telling you. Bleeding, color changes, recession. Most people ignore them. After episode 5, you won't. I'm Dr. Mario Parra. Thanks for watching. See you in the next episode.